Welcome back to the Morning Blend. CoolSculpting is a body contouring procedure that is cleared by the FDA, and it's quickly becoming one of the most popular treatments at MediSpas all around the world. Dr. Deborah Manjoney is the medical director at the Wisconsin Vein Center MediSpa, and she's here with more on why CoolSculpting actually destroys fat cells, not just shrinking them. And she brought along two of her people.
That's right.
We have Jolanta and Katie here too, because they went to CoolSculpting University.
They did.
Yes. That is so cool. I want to talk about that in just a little bit, but first, CoolSculpting cleared by the FDA.
Cleared by the FDA.
I know you love this.
Yes.
All of the people who work for you love it.
Yes,
What makes it all the rage right now?
Well, it is a simple procedure. You come in, you have it done once, and then 30 to 60 days later, you see the results. So that's what's so cool about it.
Good. Okay. No surgery.
No surgery. It's about an hour of an application to a certain area. If you can pinch it, we can freeze it. And what happens is the fat freezes within the cells, sparing the skin, sparing other tissue, and then that kind of programs a cell death, so those fat cells actually die and get excreted out of your body.
Talk about these before and after pictures, and what is so exciting to you as a doctor to look at these.
They are basically equivalent to doing liposuction in a much safer way, smoother way actually. I don't want to get plastic surgeons angry, but although we don't remove all the fat, with one application you can get rid of 22 to 25% of fat. Sometimes we do double applications to get rid of up to 40%, depending on the area, and it really works beautifully, predictably, safely, no downtime.
And the midsection is a popular area to do the treatment, right?
Love handles, midsection, but we can do the bra fat, we can do the thighs, basically from knee to collarbone, isn't that right?
Knee to collarbone. Talk a little bit about the thigh, because we have pictures too. And this is the CoolSmooth is kind of new because instead of, it's more flat rather than squeezing and pinching the fat.
There's no vacuum on it. So the other applicators all have a little vacuum attachment to suck the fat in.
Okay.
Outer thighs are one of the areas that most women want to see adjusted, okay? And so with this CoolSmooth, we can actually put the applicator right on the skin, and it's going to freeze that fat. It's going to take 2 hours instead of 1 hour for an application, but it's, again, predictable results, great results, an area that 85% of women really say, I would like to see something change about my outer thighs.
Right, and you now have the DualSculpting, so that you can do two treatments at the same time.
That's right. We can really cut down on the length of treatment time because we can apply 2 different applicators to somebody when they come in. So not necessarily, the CoolSmooth might be what we use at that time, but you could do your love handles and your thigh at one time and then switch it. So there are ways we can do all kinds of things, yes.
All right, ladies, CoolSculpting University, you were the two who were chosen to kind of lead in providers, went to this university. I bet there are a lot of happy people there.
Yes,
right?
very happy people.
What was it like? What did you learn?
It was all people that were very well experienced, so we got to really talk to other practices around the country and really talk about what people are doing, what we're seeing best results with, and really get to know the technology more than the company talks.
Because there's really a science and an art to kind of, it's body contouring, so how you apply it is really important, right?
It's very important, and the most exciting, and it's not only exciting, but it's very rewarding because every person sees great result as long as they are a good candidate. So our patients are look good, very happy, more confident, and we get a lot of hugs.
Oh, I bet you get hugs. That's so cute. And you know, the thing is, Katie, a lot of people have fat in areas that they exercise, they eat right, but they can't get rid of it, especially if you've had children, as we age a little bit. So it's exciting to be able to get rid of that fat, right?
Most people, once they hit about the 40 mark, they have trouble targeting that abdomen area or the flank. Or thighs now, and we definitely can treat those areas, and thighs are one that we can target more patients this way with a surface applicator versus a vacuum applicator.
Well, and I think Jolanta said something important in that, you know, this is something that everybody sees results. It's not like, well, try it out and see because you might have results. Everybody has noticeable fat reduction.
Now, obviously, if you have 50 or 60 pounds to lose, you're not a good candidate for this until you've lost a little weight. However, while you're losing weight, you can get this done and you'll see quicker results in the areas you want because it really will contour your body.
And it's safe. I mean, you're actually freezing the fat, right? So it's not shrinking it. That fat goes away. It's like bye-bye, right?
Yes. It certainly does.
Yeah.
Safely, in a normal programmed cell death way. So those fat cells just go away.
And wasn't it discovered because of a horse riding thing?
A couple of different things. Children sucking on popsicles had a little fat necrosis in their cheeks. And so they looked at that. That was one study or one observation that was published. And the second observation was with women who are riding horses in cold weather, seemed to kind of be able to lose that little bit of fat on the inner thighs. And so by putting those things together, these very smart scientists at Harvard decided to investigate this a little bit more. And they've been doing studies now for several years. I've been following those reports in the literature until it was released. And I was very excited about it from the beginning.
Yeah, I think it's fantastic. It's a great gift for Mother's Day, but make sure you talk to Mom first. You don't want to make the suggestion that she needs to get rid of fat.
Not at all.
But seriously, this is the kind of thing that could make moms really happy. You have a lot of other great services.
Yes.
People can buy gift cards. It's a wonderful, beautiful place to visit. The Wisconsin Vein Center MediSpa is located on Georgetown Drive in Pewaukee. They're on Facebook. Call them at 262-746-9088 because a consultation is absolutely free, and you can go to wimedispa.com. Happy Mother's Day.
Happy Mother's Day to you too,
Doctor.
thank
And
you.
nice to meet you guys.
Nice to meet
Great.
you.
Thank you so much.